Did you know that every time your heart beats, it tells a story not just of life but also of your health? This story unfolds through the rhythmic dance of systolic and diastolic pressures, the two key players in the drama of blood pressure, a critical indicator of your overall well-being. Let's dive into the world of systolic blood pressure first. This is the higher number in a blood pressure reading, recorded during the moment your heart pumps blood into the arteries. Imagine your heart as a water pump and your arteries as garden hoses. When the pump pushes water out, the pressure in the hose spikes. This is what happens during systole. Your heart contracts, pushing blood through the vast network of arteries, and this forceful action creates what we call systolic pressure. Why is this important, you ask? Well, systolic pressure tells us the amount of stress exerted on your arteries during heartbeats. High systolic pressure indicates that your heart is working too hard to pump blood, which can strain the heart and damage arteries over time, leading to serious health issues such as heart disease and stroke. Now onto diastolic blood pressure. This is the lower number noted when your heart relaxes between beats. A moment of peace, if you will. During this phase, the heart fills with blood and gets ready for the next pump. Diastolic pressure measures the resistance in the arteries when the heart is at rest. It's like checking the pressure in those garden hoses when the water isn't being actively pushed through them. A low diastolic pressure suggests that the arteries are relaxed and open, allowing for easy blood flow and less strain on your heart. Conversely, high diastolic pressure can be a red flag indicating the arteries are too rigid, which can also lead to cardiovascular complications. Understanding these pressures is crucial because they are the primary indicators used to diagnose hypertension, commonly known as high blood pressure and other cardiovascular conditions. Typically, a normal blood pressure reading is around 120 over 80 millimeters of mercury, often abbreviated as mmHg. Readings consistently above 130 over 80 are generally considered high and may require medical attention. Measuring blood pressure is a simple yet vital process performed with a tool known as a sphygmomanometer. This device includes a cuff that wraps around your arm and inflates to constrict the blood flow. As the cuff deflates, a healthcare professional listens with a stethoscope or an electronic sensor is used to detect the blood flow, capturing the systolic and diastolic pressures. In summary, blood pressure isn't just numbers on a chart. It's a dynamic indicator of how well your heart and arteries are working together. Systolic pressure highlights the force of blood during heartbeats, while diastolic pressure gauges the baseline resistance in the arteries. Keeping these numbers within a healthy range is crucial for maintaining cardiovascular health and preventing long-term complications. Remember, managing blood pressure is an integral part of leading a healthy lifestyle, and staying informed is the first step towards taking control of your health.